Hey everyone, so for my literature review, my PICO question was, in patients diagnosed with borderline personality disorder, how does the implementation of pharmacotherapy in the effective management and reduction of BPD symptoms? So just a little bit of background, BPD is a mental health disorder characterized by instability in affect regulation, impulse control, interpersonal relationships, and self-image. Clinical hallmarks include emotional dysregulation, impulse aggression, repeated self-injury, and chronic suicidal tendencies. The reason I chose to do this topic was because I worked in mental health for a year as a CNA, and a lot of the patients that I saw had BPD, but one in particular that I spent a lot of time with, she had a severe case of it, and I was just more curious in what kind of medical interventions or pharmacological interventions and other interventions could help her in managing those symptoms. For the most part, antidepressants show little to no efficacy in reducing or managing BPD symptoms and should not be recommended for treatment. It should only be used during major depressive episodes or something relating to that. Mood stabilizers such as topiramate, lamotrigine, and valproate semi-sodium have shown to be more effective in reducing impulsivity and affect dysregulation symptoms related to BPD. And lastly, antipsychotics were studied, and it showed that second-generation antipsychotics such as aripiprazole have been beneficial and efficient in reducing impulsivity. All in all, pharmacological interventions do help reduce BPD symptoms, but they're not a means for a cure or anything. There is no cure for BPD, and remission should not be expected from this. But there is more research that needs to be done in order to make this information and these studies applicable to clinical settings. And hopefully future research will be aimed at determining whether the concurrent application of pharmacotherapy and behavioral therapies is effective in managing those symptoms produced by BPD.